Hello, everybody. My name is Dr. Aamir Abbas. I'm here today once again with our series of talks related to COVID-19 pandemic. And today we have a very distinguished guest with us. He's a graduate of Khyber Medical College. His name is Dr. Usman A Raza. He did his MS in Health Policy and Management from Howard School of Public Health, MS Health Information Management and System from UC Berkeley School of Information. He has more than 10 original research papers cited by other researchers from 20 different countries. He has worked in more than a dozen leading organizations. Some of them, I will not go through all of them, but some of them that include Pear Therapeutics, HealthTap, Cancer Commons USA, he has been working in UC Berkeley, and in Pakistan, he has an extensive experience of working in different UN agencies that include UNAIDS, UNDP, UNICEF, Prime Institute of Public Health, and many other institutions. Dr. Usman A Raza is a leading product management professional in the digital health space. He is currently working with Pear Therapeutics, which is the world's first company to receive FDA approval for prescription software to treat serious mental diseases. Previously, Dr. Raza has worked in a technical product development role on an artificial intelligence-based symptom assessment tool in HealthTap. In Silicon Valley, Dr. Raza is a graduate of both UC Berkeley School of Information and Howard Public School, and has successfully combined his expertise in medicine, public health, and software. He is a recipient of several prestigious fellowships, including Fulbright Fellowship and School of Information Fellowship. He has over 10 years of experience in public health at national and international organizations. So first of all, Dr. Raza, thanks a lot for giving us time.
Thank you very much for having me here. I'm glad to be speaking.
Okay, so as you know, our today's topic is a different aspect, and specifically some aspects related to the policy pertaining to COVID-19 pandemic, but we will be talking a lot related to how the data is being managed in this context. So to start with, and without wasting any further time, what do you think generally about the policy when we talk about COVID-19 pandemic or such a pandemic or epidemic at the level of Pakistan?
Yeah, so Aamir, I'll start by saying that this is a major disaster. It's not any single country or a few countries, but all over the world, every country is facing a major problem with this pandemic. So when we talk about policy making and guiding the healthcare operations through policy, this is something that is unprecedented. So I'll comment first by saying that even countries that are well developed and they have robust systems, even they have been facing challenges. So this is something that nobody was prepared for. So I want to keep that in context when we talk about policy, and then we can go a little bit more towards Pakistan's situation. There's definitely need for long-term planning, and long-term planning is about disaster management in general. It's not specific to health sector. For example, right now, this pandemic is not just a health disaster, it's an economic disaster as well because of the lockdown and everything else that we're seeing that's going on with it. So obviously the policy and planning for how to handle these kind of situations in future, which are rare but possible, has to be expanded to not just health sector. It's a responsibility of all different sectors. I don't believe that we have such a strong policy development process in place at the country level right now. However, there is some good amount of effort being put into the immediate short-term needs for providing guidance to different sectors, including healthcare providers and the police department, the other sectors that are dealing, social sector in general, and the Ministry of National Health Regulation, I think it's called NHSRC, that's playing a good role, I would say. There's more to be done, but just as an example, and I'm sharing this for the benefit of the audience if somebody is wondering, if you go to the covid.gov.pk guidelines section, you will find a lot of useful guidelines for many different things. And if I just share my screen for a minute, I can actually share with you so people can take a look. So this is the website that I'm talking about. So we have, and these are recently updated guidelines on how we're doing decision making in healthcare. This is about allocation of resources, clinical management, outdoor patient departments, how they should work, how home isolation should happen, air transport, air travel, how to deal with burial and safe management of the dead bodies, guidance for railway stations, trains. And there's just actually quite a lot of material that people may not be aware of. And although a lot of effort is there already, as you see, and this needs to be disseminated properly. I do think there's an issue with readability. I don't expect busy physicians and clinicians to go through long documents. So this could be done a little bit better, maybe in some more readable format, which is easy and quick for people to understand. Also maybe translate into different languages, local languages, and disseminate this through different media channels widely. So I think when we talk about immediate needs, those are being met partially. I would say there's more work to be done there. One thing when we talk about policy and planning and guidance is one piece that I do feel missing is there is no guidance on data collection and data management for COVID patients. And in general, we have a weak, I would say we don't have a lot of investment in information systems as a whole.
Thanks. This has been a comprehensive overview of these documents. So do you think these documents are obviously not policy documents, right? These are just standard operating procedures. Going ahead with what you said, can you elaborate on like if there are some policymakers and or some public health professionals listening to this, how specifically would you guide them that this document should be disseminated from the media channels into different languages? Do you think we need to make short videos? Would that be helpful? What behavior change communication strategy would you recommend in this context?
Yeah, so behavior change is a broader topic in itself, but just focusing specifically on how we can disseminate these better. Yes, we can use media channels. Like making videos is one simple way of disseminating these. Thanks to the availability of smartphones and Facebook and YouTube, everybody has that, and WhatsApp is there. People like to watch videos more than read, unfortunately, I would say, but maybe we can use this to our advantage. So yes, that's one opportunity. But I want to say this is not a sole responsibility of the national ministry. It is up to the provincial departments of health and the people who are decision makers at that level to take up these guidelines and disseminate them and enforce them as best as they can. Of course, looking at the resources, there's a big question mark around availability of PPE for providers, for example. So just telling somebody that you should wear a mask and shield and XYZ every day when it's not available, that doesn't work. So it has to be multi-pronged. There's resource limitations there which need to be addressed. So what I want to say is there's dissemination, but there's also on the provincial level, there's a need to absorb this and disseminate further at lower levels. So it cannot be expected of the national bodies to go down to the very grassroots levels. It needs coordination with provincial departments.
Okay, the reason I brought this topic up was there has been an extensive debate in the media and among different politicians as well that there is a confusion in like whether you want to go for the lockdown, whether you should not go for the lockdown. So how would this gap, I mean, is there a lack of a proper policy or there's a lack of a proper strategy? How do you technically classify this gap at this point?
Um, I think classifying it as a policy or a strategy problem may not be fruitful at this point. We need to make decisions. Okay, we can call them whatever we call them. We can call this a strategic decision that needs to be made quickly and based on whatever information is available. Personally, I think there is no question of whether a lockdown was needed, and there's no idea of, oh, it was too early to lock down, because that doesn't make any sense to me. There could be too late, and I feel like our government did take the right decisions. The enforcement of those decisions is a different question. How much those decisions are actually followed, and when we come to things like social distancing, this is not something that the police can enforce. For example, this is dependent on public's uptake of the message and awareness and their understanding. So one thing, for example, which I think is not going well is stigmatization of this disease. So if somebody is diagnosed with COVID and they're at home, and somebody from a law enforcement agency shows up and they want to take you, this is obviously going to stigmatize the disease, and people will start hiding the facts. And that's anecdotally what I'm hearing is that's happening. People are not sharing the information because they're scared of this kind of treatment. So that's an example of how not to do it, I would say. The public needs to understand and gain awareness, and that takes some time, but that also needs to be in a positively enforced way, not pressurizing people through these kind of tactics. So as far as lockdown is concerned, I think it was a good decision early enough that if there was any effect, it has had its effect. There's the second part where we are now seeing that the lockdown is being lifted or partially lifted. That is more complicated, and it depends a lot on what we are seeing with the disease progression, how the incidence or the case death rates are going, and many other factors. So that's very hard, I would say, to predict what's going to happen, because people's behaviors are hard to predict.
Right. And so what we get from your discussion is that whether we call it a strategy or whether a clear policy, but a clear message to the to different stakeholders is needed, and clarity in decision-making process. I mean, a clear decision and then implementation of that decision is extremely important. So this is all the discussion which we had related to the policy. Now we go towards your second expertise, because you have a skill set of combination of policy and data, and we are going to be spending more time on data, and because that's very important. So what do you think generally about the different dashboards which have been presented and from the government portals related to COVID-19?
Sure. So there are several data sources available online. And I've been looking at the health sector information system in Pakistan for more than a decade now, and how we have dealt with previous disasters. We've seen the earthquake, we've seen the floods, and so on, and so many other things have happened, dengue and so on. This time, I would say I was surprised by the speed with which some data was made available, and there is a dashboard on the website where you can go to and find the latest numbers. There's of course a separate question of the quality of data and reporting, how well that's happening. We can talk about that too, but as far as making something available to the public and to the people who are working in the health sector is concerned, I think the government did a good job of getting something up and running soon. And for the benefit of the audience, I think maybe if I share my screen, I can tell you what exactly I'm talking about. There are, of course, issues. There's definitely room for improvement. So this is the covid.gov.pk website, which is, I think, maintained by the National Ministry of Health Regulation. You are able to see confirmed cases, active deaths, and recoveries. I'm not sure how recoveries are being counted here, so maybe case definitions need to be present. You can see provincial breakdown. There's a nice map here. But beyond this, there's a bunch of graphs, some of which are useful, some are not so useful. There are some basic information visualization flaws that should be addressed, in my opinion. So, for example, if you're looking at death rates, you can actually, there's no graph that is showing the number of daily deaths, which is the metric that I think is the most useful right now. The reason I say that is because number of cases, confirmed cases, is dependent on testing. It's dependent on demographics. It's dependent on whom you test and how much you test. So it's very easy to get that number swayed or skewed if testing strategy changes, for example. So let's say if you are testing only the most symptomatic people who are almost guaranteed to have COVID, then you'll get a very high, you'll get a small number of cases, but high percentage of tested positive amongst those who are tested. But if you broaden the testing strategy and you start testing everybody, then of course you'll get a smaller percentage. So that's why I try to follow the number of daily deaths, and I don't see that easily available in this chart, for example. But anyway, I'd say it's a good attempt. There's some useful resources available here. There's definitely room for improvement. So to give you a little bit more idea of how I look at things, and I've been following this, case fatality rate is something that I'm looking at. However, this is dependent on testing and how many confirmed cases we get. So this is not the primary metric that I try to look at. It's only for comparison across different provinces. But then if you look at mortality per million, that's another metric that could be useful in the dashboard. And just last night, I was playing around with these numbers, trying to see what's the proportion of cases. So something interesting that policymakers should look at, for example, let me zoom this a little bit. Yeah, so this is showing what is the percent of total population residing in each of these different territories, including Islamabad, which is a separate territory. And then what is the proportion of cases, confirmed cases in each of these regions? And do these match up with the population? So is there a mismatch between how much population resides in a certain province or state or region versus what's the burden of cases they have? And the same thing for percent of deaths. So for the purpose of this discussion, we can ignore Islamabad, which has less than 1% of the population. We can probably ignore Gilgit-Baltistan and AJK. These are very small numbers, and it's easy to skew these numbers with little changes in the absolute numbers. I would also not put too much emphasis on numbers for Balochistan because those numbers are also pretty low. But the three that we can easily look at and get an idea of where things are not looking like there should be is this obvious discrepancy here. So Punjab has half of the country's population, but Punjab has 37% of the cases and 34% of the deaths. So there's one interesting data point that we see. If you look at Sindh, it has 22% of the country's population, but it has 37% of the cases and it has 32% of the deaths. Then you look at Khyber Pakhtunkhwa. We have 16% or 17% of the country's population. We actually have 13% of the cases so far based on whatever testing is going on, but we have a large share of the deaths. It's almost 28% of the deaths. And so just doing very simple analysis, and I'm not going into like models and complicated things. This is very straightforward, simple things that pop out, and you start to question what's going on in KP, what's going on in Sindh, what can be improved there. So these are kind of things that we would like to see in dashboards and decision making in general. Yeah.
So if you go back, I mean, I just want you to keep your screen shared because I have a number of questions in that context, especially if you can share your
Sure.
the dashboard which you just, yeah, this one. So before going and before concluding into, or before even raising a question that the mortality or morbidity of the virus may be different in different geographical region, as an expert on informatics, do you think this is a reflection of that data is being managed differently in different provinces because health in our country is a provincial matter?
Yeah, this is so the interesting data points that I was talking about. It's everything that is dependent on how the data is collected, what is the information system that is being used. Plus, then there's the question of how testing is being done in different provinces. So maybe Punjab is testing a lot of people, and maybe in KP we are testing very few people. So there's those variables which are not reflected here, of course. So I wouldn't say these are like conclusive evidence for certain differences, but it's giving you some good questions to explore. The question of how data is being managed, I don't have visibility into how this is being collected exactly. I presume every hospital is supposed to report or notify the national ministry through some method of number of cases they're receiving, number of deaths, and the testing labs are also doing the same. So perhaps that's the mechanism being used. However, there can definitely be questions around case definitions, how they're being used by different hospitals. Yeah, so I would say without having a lot more detail into how the information is being collected and compiled, it's reasonable to say that there could be reporting differences between different provinces and how well data is being collected and managed in different provinces.
And I have a couple of more questions in this context. First of all, is that if we are not conducting enough tests, then obviously mortality rates attributed to, I mean, the number of people who are attributed to being killed or dying because of COVID-19 will also not be reflection of the true picture. Do you agree with this argument?
We need to think about what's the metric that we should follow? What's the right metric? Testing is, how many people we test is important, of course, and that defines what is the number of cases. But then there are other important things that we're not looking at least not available in this dashboard that I have. In terms of, what matters for the health system is how many people are symptomatic enough that they need to be hospitalized. That is what's taking up resources. So if you don't have data on hospitalization, what's the percent that is being hospitalized, for example? I don't know that. Maybe there's data available somewhere. That will help in planning of resources. How many people are in ICU? How many ventilator beds are available or not available? I believe actually there's some system now being put in place to to track the number of beds with ventilators. That's a good step, I think. But we need, in general, some way of analyzing how much hospitalization is happening because of COVID. There's another longer term issue that we need to worry about, which is what kind of hospitalizations or procedures are not happening because of COVID. So are people dying more at home due to cardiac arrest, for example, from which they could have been saved if they were to visit the hospital in time, and they're not going there because of COVID. So that's another area that the policymakers need to worry about, and it's going to show up as soon as the COVID crisis starts going down a little bit. Then we're going to start seeing more of this other boost in cases and disease burden.
Yeah, my subsequent question pertains to me sharing my screen, and it is relevant to one of the dashboards from an international website. So before I ask my question, can you see my screen?
Yes.
Okay, so this is, you must be knowing that this is a famous dashboard which has been collecting the data all around the world, and this dashboard is from Pakistan. Now, I have a couple of questions in this context. First of all, if you see the trend overall, and these are the new cases which have been projected right now, there is a high variability of the cases, like if you see from the 9th of May of 9th and June 6th, right? Individually, if you find out the standard deviation of the new cases, that's very high. Is that the reflection of lack of standardization of reporting procedures?
It could be a mix of many things. It could be the actual number of cases rising. It could be us getting better at reporting. It could be us getting better at testing. So it could be any of those things. And it's hard to say just by looking at these charts that this is a reflection of any one of these. But it could be any combination of those different factors. What I would say is that people should not read too much into the day-to-day fluctuations of number of cases or number of deaths. It's bound to have some variation just because a report came in late, and so it was not included in today's listing of cases, and they added it tomorrow, and so on. So those kind of like minor anomalies do happen on a day-to-day basis, and we shouldn't base any conclusions based on, today the cases went up a lot. That's not very helpful. What we need to look at is the overall trend and how that is going. So one simplest measure could be, you look at a moving average, let's say a moving average of 7 days. For number of deaths, I like to use moving average, which is a bit longer because there's some distance between somebody being symptomatic and then on average how long it takes for them to reach the point at which they die. For those who die, I'm using a rolling average of 18 sometimes to take a look at the longer trend. And I'm happy to share my screen to show you some of the analysis that I've been looking at. And it's very straightforward and simple trends. It's not taking into account many of the factors, but it does give us slightly better idea than what you might get from looking at a daily fluctuation. So this is, I think the data source is the same that for the dashboard that you shared. This is collecting data from the Johns Hopkins University data stream that has been fortunately made available to all the world and anybody who wants to use that data. We're looking at number of daily deaths, which I think is the most important metric from all those metrics that are available today. There are other important things like hospitalizations, which would be very useful. But amongst the three metrics that people commonly talk about, number of cases, number of recovered, number of deaths, I think that looking at number of deaths and daily trend of deaths is more important. There is less likelihood of misreporting in deaths than there is in cases. So Anyway, so what you see in the light dotted line is the daily number of deaths. And you can see there's a lot of fluctuation. However, if you look at the 18 days rolling average for number of deaths, you can see that the trend is more or less going up. And a few days ago, there was a huge spike in the number of deaths, and people got very alarmed. And then next day, it came down a little bit, but not so much. So if you look at the trend, the 18-day rolling trend, it is indeed going up, which is not good. This is not a good sign, of course. One tip that I would tell people who are playing with data is to not do this, what I'm just going to do here, and show you what's the problem there. So if you put number of confirmed cases and number of recovered cases together with number of deaths, the death line is almost flat, and you cannot make any useful conclusion out of this because it's squished and the scale is too high here. So that's one small tip I would suggest to people who are playing with this data.
Okay, so going ahead, like we had some discussion on these dashboards and taking our discussion forward on a different aspect of this, which is there has been a lot of discussions and all the defense which has been put forward by the Federal Ministry of Health is that there is not a lot of cases, but there's a lack of proper coordination between different hospitals and how to properly manage the cases, right? And it has been suggested that a centralized dashboards, at least at the provincial level, is made to facilitate effective coordination between different hospitals for managing different beds and available ventilators and things like that. How do you think, what would you suggest as an expert in this field, that how should the provincial ministries of health go ahead with this?
Yes, I think that's the right call to make. As I said earlier, everything cannot be expected of the national ministry to coordinate and complete, especially when you go further down at the hospital levels, which are largely coordinating at the province with the provincial departments of health. Every department of health has a unit which deals with information systems, and typically they are managing the district health information system data. So DHIS is there. I think that they should be equipped with what we need for managing the data and information for this situation as well, and I'm hoping they are doing that. It'd be good to have dashboards at provincial level as well, but I think we already have some of that at the national level. Doing a breakout at provincial level should not be very difficult for that dashboard. At provincial level, we do need to have something which helps us in coordination of resources, like you said. So there's at least two things to think about here. One is the large hospitals in large cities. We need a way to coordinate the resource allocation, and it should be centralized at the provincial level at this point. We cannot, in this disastrous situation, have one hospital saying we're not going to take more patients and the other getting more burden. It needs to be distributed according to the situation, and it needs to be in coordination with the government, with the private sector. Maybe there's also some need for incentives, but I wouldn't go there too far. However, definitely there should be some coordination cells, just like we have coordination cells. For example, polio vaccination has a lot of investment in it, and there's a provincial control room kind of available for coordinating this whole data management. Something similar could be done in a short-term basis for COVID, and that would be very helpful. Then the other piece that I want to mention here is, although we have the disease mostly showing up in the large cities, it is starting to spill over into smaller towns and villages. And over there, we don't have large hospitals. The infrastructure available there is the rural health centers and BHUs, basic health units. There are healthcare staff and personnel available there. They need to be trained on how to deal with this. They need to be trained on case definition. They need to also start reporting if they find or suspected cases are found at that level.
Taking that discussion forward, and if the provincial governments decide to deploy such an initiative, you know that the way healthcare is provided to the people in Pakistan, like there is a decision maker at the level of a unit in a hospital, that is a clinician. Then at the administration, there is another decision maker. Then at the district, it's bureaucracy, and then the provincial Ministry of Health comes in. And so there are multiple layers of decision makers in Pakistan. So in this context, what impediments do you think can be there, and how do you suggest in this emergency situation that the government should tackle with them?
Yeah, so this is obviously there's multiple levels, and we cannot expect each decision to be escalated to the highest level for decision making. So the guidelines that I referred to earlier is an example of how we can tackle this much easier. There needs to be education, awareness, and guidance of people who are at the front line. So hospitals and clinics and BHUs and RHCs, the managers sitting at that level need to be aware of the protocols and what kind of cases they need to refer where. So it has to be a lot of education, awareness, and training. And it has to be on emergency basis. This is because the situation is evolving very fast.
Okay, and I think we are near to, because we want to keep this talk short but comprehensive, we are near to the completion of this talk. Before we end it, it is an important question that the data related to the management and different aspects of the individual COVID-19 patient, we have the data open sourced in the form of numbers coming out. But I mean, if we wait for the evidence to be generated in the form of routine research projects, that's not going to happen. That's going to take a long of time, and that's not going to be useful in this situation. So do you think that for some number of the patients, the government should initiate sharing of the data and the associated factors with the researchers so that they can generate some evidence?
I think the simple answer is yes. I would differ a little bit on the first point, which is around research. Of course, there's going to be long-term research, which takes time. But here's my point of view on data collection and information collection and understanding and learning from that. This is a new disease, and every patient who's recovering or dying because of this disease represents highly valuable data that we can use to learn from and get better at treating COVID. It is understandable that we do not know, today we do not know this disease very well. We don't know exact pathogenesis of this disease. We have a lot of theories why it's affecting certain groups and not the other groups. And patients are dying. But if we don't collect good data from these patients, then we are wasting these lives. A lot of data is being collected in different countries for every patient, and they're doing autopsies and looking at they're doing genetic testing for receptors and many other things, just trying to understand what is going on with this disease. How are we going to tackle this? And we need to do the same in Pakistan, and we need to use this for research and learning so that the next patient who comes in with COVID has a better chance of survival. So I would urge people who are at the hem of affairs to promote comprehensive data collection. Number of cases and number of deaths is not enough for that kind of research. We need to know detailed symptomatology. We need to have genetic testing for the viral strains that are being identified in patients who are being tested, both recovered or dying. We need to do testing for different kinds of receptors that are potentially susceptible to this virus. There's a lot of epidemiology work to be done. We need to understand the exact demographics. For example, things like age factors and comorbidities and things like that. Sure, there are other countries that are doing research and collecting these data, but we still need to do this in the context of Pakistan. There can be significant population differences, and that could be helpful for the rest of the world too.
Right. Before we call it off, and it was a very comprehensive, short discussion, is there any aspect which you want to highlight, which we have missed, and that is important for the decision makers to know at this point in time?
I think the last point that I just made about comprehensive data collection is something that it's so important that I would repeat it. We need to be collecting very detailed information about each patient that is confirmed with COVID, and we need to follow them. Whether we use technology for that purpose or we want to use the old paper-based methods, that's a different question. But we are losing data if we're not collecting all that information, and we're losing an opportunity to learn. And why I keep saying that is right now, if you look at the guidelines for clinical management, for example, that's just one aspect. These are based on what has been tried elsewhere in different countries. Populations can be different, viral strains can be different. So while this is all right to get started with, we do need to understand our own population and what are the specifics of this population.
Thanks a lot, Dr. Usman A Raza, for giving us time. I know that you are extremely busy, and it was really helpful for us. And I think this program will be helpful for all those who need some guidance in this field. And your unique combination of public health policy and informatics will be beneficial to everybody. I think that's all from our side for the time being. Take care of yourself. Allah Hafiz and bye.
Thank you very much. Hafiz.